Hi, anatomy students, and this is lab exercise 15 on the respiratory system. So like usual, you can follow the virtual lab link to practice, labeling a lot of these pictures that you see, and then I'll post a Google lab activity for lung volumes in the announcements for the 5 points you can get. So the respiratory tracts, as we talked about in lecture, we can divide your respiratory system into the upper respiratory tract and the lower respiratory tract, and you should know the difference of the structures in each. And this is a look at the structures of the nasal septum with the perpendicular plate of the ethmoid bone coming down the middle. You can see the sphenoid sinus, the frontal sinus, and then the hard palate at the base of the nasal cavity. Here's the soft palate, which is this part where the uvula hangs down. The lateral wall of the nasal cavity contains 3 nasal conchae, the inferior, middle, and superior nasal conchae. And again, those are kind of ridges on the lateral wall that help to humidify the air, condition it, warm it, and moisten it. Here's a look at the pharynx, and the pharynx is just another word for the throat. The pharynx is divided into the nasopharynx, which is the throat behind the nasal cavity. The oropharynx is the throat behind the oral cavity, and the laryngopharynx is behind the larynx. The auditory or eustachian tube opens in the nasopharynx. Here's your oral cavity, and then the larynx will be at the top of the trachea. The trachea goes down the anterior side of the neck, with the esophagus going down the posterior side of the neck. There are different cartilages of the larynx. You have single cartilages, so only one of them, and then paired cartilages. The single cartilages are your cricoid, epiglottis, and thyroid, and then you have paired or 2 cartilages of each, the arytenoid, corniculate, and cuneiform. So here are just the structures of the larynx and the trachea and the different cartilages. Here's the thyroid cartilage, the biggest cartilage with the Adam's apple in front. Here's your epiglottis, which is that kind of tongue-like structure, the flap that will close down over the larynx when you swallow food so that food doesn't go down into your windpipe. The cricoid cartilage is right below your thyroid cartilage, and then you can see the other kind of cartilages listed as well. You can also see the tracheal cartilages, the rings that keep the trachea open at all times to keep the air from going down so it doesn't collapse on itself. Here's maybe a better, cleaner look at the medial view of a model of the cartilages of the larynx. Here's the cricoid cartilage, the thyroid cartilage, the corniculate cartilage, the cuneiform cartilage, the epiglottis is shown there. And again, the epiglottis will close over the opening of the larynx when you swallow food. A posterior look at the model of the 3 paired and 3 single cartilages. Here's the arytenoid cartilage, corniculate, and then cuneiform. So kind of going from superior to inferior, we have cuneiform, corniculate, and arytenoid. And then the thyroid is the large one on the sides with the cricoid cartilage below the thyroid cartilage. Here's a look at how the trachea, so after the larynx, the trachea will continue to flow air into the lungs. The trachea splits at a point called the carina into the right and left primary bronchus. Primary bronchi split into secondary bronchi, and then secondary bronchi split into tertiary bronchi. So it makes this kind of tree branch-like structure, moving from trachea to primary bronchi, secondary bronchi, and tertiary bronchi. Here's a look at the lobes of the lungs. So you'll notice the right lung has a superior, middle, and inferior lobe, whereas the left lung just has a superior and inferior lobe. And that's because the left lung leaves space for the heart, which is on the left side of the sternum. So we have a cardiac notch and then the cardiac impression where the heart will sit. The base of each lobe sits on top of the diaphragm. You have different fissures, which are just kind of separating grooves between the lobes. And then the apex of the lung will stick up a little bit past the clavicle on either side of the trachea. Here's a look at the hilum, the hilum of the lungs. The hilum is the root of the lung where all of the primary bronchi, pulmonary veins, and pulmonary arteries will enter. So we're looking at medial views of the lungs. Here's the left side. You could see the cardiac impression, and then the hilum with the vessels going in and out, and then the right side of the lung with the superior, middle, and inferior lobe. Here's a look at the trachea, the pseudostratified ciliated columnar epithelium with goblet cells. The goblet cells will secrete mucus that trap any sort of particles in the air that should not be getting into your lungs. And then the cilia moves that mucus to get the mucus trapped particles out of the lungs. And again, smoking will actually damage and completely destroy the cilia in this epithelium, so that smokers usually develop a smoking cough because they don't have the cilia to move the mucus with the trapped particles out of their trachea. So they have to physically cough a lot more to try to get those trapped particles out. Here's another look at the histology of the lungs. This is showing the alveolus or air sac and how it's lined with type 1 and type 2 cells. The type 1 cells are the squamous shaped with the flat nucleus. Type 2 cells are more cuboidal shaped and they'll secrete surfactant, which reduces surface tension to keep the air sacs open. Dust cells are just known as macrophages that will engulf and remove cellular debris and bacteria. And that's the end of this respiratory exercise 15. Work on that virtual lab and I will post the lab activity link for the Google activity.